ਕੈਨੇਡਾ ਦੀ ਚੀਫ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਥੈਰੇਸਾ ਨੇ ਕੋਵਿਡ ਆਊਟਬ੍ਰੇਕਸ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ। ਇੱਕ ਚਾਰਟ ਦੇ ਜ਼ਰੀਏ ਡਾਕਟਰ ਥੈਰੇਸਾ ਨੇ ਕੈਨੇਡਾ ਵਿੱਚ ਕਰੋਨਾ ਦੇ ਵਾਧੇ ਘਟਦੇ ਕੇਸਾਂ ਦੇ ਅੰਕੜਿਆਂ ਬਾਰੇ ਜਾਣੂ ਕਰਵਾਇਆ।
So all jurisdictions in Canada, with the exception of Nunavut, have reported cases of COVID-19, and this is since the start of the epidemic in Canada. So the higher rates are in dark blue if you have the slides in front of you. The incidence rates per 100,000 population illustrate that some jurisdictions and health regions have experienced very limited activity, while others, including the more populous areas, have had more intense activity over the duration of the pandemic so far. So in the boxes to the right, the demographics, so the age, for example, gender, and the severity indicators have remained as presented in the previous epidemiology and modeling update in July.
Merci. Diapositive 2. On va commencer.
Slide 4. The trend in new cases and deaths reported daily illustrates the decline in COVID-19 activity since the peak in late April. The recent increase in cases since early July corresponds with localized outbreaks and community transmission in provinces outside of the Atlantic region, reminding us of the need to remain vigilant with our public health. Slide 5. To keep a close watch on the severity of COVID-19 infections, we continue to closely monitor the number of cases who are hospitalized and those admitted to intensive care units. Seeing the decline in these severity indicators gives us reassurance that our public health measures are helping to minimize severe illness and deaths due to COVID-19. These indicators have remained low during the month of July, though they have plateaued more recently. Over the coming weeks, we will continue to closely monitor for any change in severe illness patterns. The highest incidence of COVID-19 since early July has occurred among individuals aged 20 to 39 years. Although severe illness is less common in younger individuals, they are not immune to severe outcomes. Moreover, transmission in any age group builds a reservoir for the virus that threatens our ability to maintain epidemic control. We do expect to see some increases in the number of daily cases as we move forward with reopening, and it is our collective responsibility to limit the size and impact of these surges. It will be important to keep infection rates low to prevent sparking an outbreak or setting off a chain of transmission that could enter a population or setting at high risk for severe COVID-19 outcomes.